Our next panel will be discussing schools and how they're changing the landscape and the narrative with immunizations. Schools have a unique role in having to do quite a bit of immunization reporting. And here today to talk more about that and how that can be influential in this area is Michael Ambrose, founder and CEO of SchoolDoc, Dr. Jen Terriall, Director of Student Services at Livonia Public Schools, Carmela Gupta, Senior Program Manager at the American Immunization Registry Association, and Tina Scott, Section Manager at the Division of Immunizations at the Michigan Care Improvement Registry in MDHHS. This panel will be moderated by MiHIN Solutions Analyst, MiGHIN Gibbs. Welcome.
Thank you, Shelley, for that introduction. So like Shelley had stated today, we're here to talk about how schools are paving the way and changing the narrative for those immunization records and how they're currently being exchanged and collected and transmitted across organizations. So I've had the pleasure to work with or speak with our panelists today, and they're a very intelligent, knowledgeable group. So I wanted to extend a second thank you for not only attending the conference, but agreeing to speak with us today. And so I wanted to start off and introduce and briefly describe just how I've had the pleasure and opportunity to work with these folks. And so I wanted to, again, introduce Dr. Terriall and Tina Scott, introducing the both of you together. Tina and Dr. Terriall have played a huge role in our consumer-mediated exchange pilot. So you're probably wondering, what is that? And so we came up with a pilot program that we worked with the Livonia Public School District as well as Mickrs, and we implemented the functionality within Livonia's parent portal to allow parents to access their child's immunization records. So they didn't have to go to the provider office, they didn't have to schedule those visits or pay the fee to receive the record. They can log on at 11 o'clock at night when they realized, I need my immunization record for my child the next day, and print that off at their own leisure. Dr. Michael Ambrose, with founder and CEO of SchoolDoc. MiHIN and SchoolDoc are working together to also implement our consumer-mediated exchange functionality within their portal as well. And then Carmela Gupta with the American Immunization Registry Association, also known as ARA. We're also both very interested in working together towards the common goal of easily exchanging immunization information amongst healthcare systems. So the first question I have for each member of the panel is, how is your organization currently collecting and exchanging immunization information today? So Dr. Ambrose, you want to kick us off?
Absolutely. So thanks for having me on the panel. Great to be here. So SchoolDoc is an electronic health record system for schools and summer camps. We work with about 1,200 organizations across the country in every state, and certainly quite a few in Michigan here as well. Different from a traditional EHR that you may use or work with at a doctor's office or at a hospital, the data collection tool, we have a dual portal system, so our parent portal actually allows for the collection of information. So instead of families filling out paper forms, they can now complete all of that health information online, including their immunization information. The struggle that our camps and schools that we work with have obviously had is getting their immunization data into the system. And so we currently have two methods in which that information can be submitted. There is a manual entry system in which the parent or guardian can enter in each vaccine date by date. That presents obvious challenges in that families often don't know that information, don't have ease of access, and run the risk of data inaccuracies. The other option is that they can scan and upload that document into the system that they might have from their physician's office. But then on the flip side, for the school or the camp themselves, that presents lots of challenges if it's in a PDF format, having to manually go through and review to make sure that each student is in compliance.
Well, Mickrs has been involved with health information exchange since the very beginning here in Michigan. We were the first registry to receive an HL7 message and to participate in health information exchange with state of Michigan systems. It has been quite revolutionary over the last 8 years. Since 2012 is when we first started working with HL7 messaging. Currently, just to give you some stats, we receive about 7.7 million immunization records a year, or vaccinations, I should say, a year. Currently, over 77% of those come in via HL7 messaging. Probably the more impressive statistic is we began with query in 2015, and currently, I don't know where Tim Pletcher is, but he's the one that got us really going on query. You'll be impressed with this. We receive over 2.9 million queries a month. That's over 94,000 queries a day for people asking for what is their immunization history and forecast. Over 58% of the participating physicians in query are non-immunizing providers. So those are your specialists, those that work with chronic condition patients who need to know the immunization status of their patients. So we've got a long history in health information exchange. We've been really excited with our new adventures into portal and consumer access. I don't know if you want me to go into that at this point. Our first consumer access project was in 2018. We're leveraging query because we have the ability to send a PDF of a patient's Mickr record to them via query, and our first system that we worked with was the Medicaid's MyHealth button, MyHealth portal, so that Medicaid beneficiaries could push a button and within seconds receive their PDF record for themselves or their child. So they were the first organization that we worked with, and it was obviously within the Department of Health and Human Services. We worked with our own first. But we were very pleased then to work with Livonia Public Schools with regard to how to go outside of our state systems and provide that same consumer access to parents through a secure parent portal.
So ERA is actually a membership organization, so we do not transfer immunization data ourselves. Because of the name of our organization, we do get calls sometimes from people thinking that we have access to every immunization registry in the country and they want to track down the records, but we sadly don't have that information for them. But what we do is we work with the IIS, so the Immunization Information Systems or registries across the country and territories. And so there are 64 of them total. And as a membership organization, we facilitate collaboration to create guidance. So whether that's for interoperability or coverage assessment reports or whatnot, there are various steering committees that our members are part of. And we also have a national meeting each year. This year it's in August in Indianapolis. It's a 2.5-day event attended by about 400 individuals that represent the IIS community in our country. But it's a really unique role that ERA gets to play, working with all the IIS and helping them work towards promoting IIS data and implementation.
Good afternoon. I want to give you a little bit of background about this from a public school perspective. So we are required 2 times a year to have our students' immunization records at 90% in November as well as 95% in February. And our immunization percentage rates are tied to financing. So if we do not have our immunization records or waivers in the Mickrs system, then the state can withhold 5% of our school aid funding from our school district. For Livonia Public Schools, that's about $500,000 that they would withhold until we have our records up to date. So Livonia is a large district. We have over 14,000 students. So if you think about the enormity of these records coming in, we have approximately 850 incoming kindergartners for the class for the upcoming 19-20 school year. We have approximately 800 incoming 7th graders. And then also our students who are newly enrolled to our district, we have anywhere between 100 and 200 students every single year coming into our district that we require their immunization records. So what typically happens is a parent has to go back to their pediatrician, find that record, and then bring it to us. Or if they do not have it, then their child is excluded from the public school system until they can either have their record with us or have a waiver signed by the health department. So looking at the importance of that, I was able to meet with Aaron from MiHIN, who came to me regarding a pilot program, working on sharing some information through Mickrs as well as Livonia Public Schools. This was not a part of our discussion, but yet here I am. So looking at working with Mickrs, working with MiHIN, working with our ISD, because our ISD is the keeper of all of our student records. So for those of you who have children, your parent portal is something you could log on to for your school system. You know that it's a secure site. You have your own username and your own password that you create, so only you can access that parent portal. That's where you check your student grades, et cetera. So we utilize that parent portal system as a secure system, always keeping in mind data security, FERPA rights for families. Who else can access those records? Well, it's only the parent that has access to that username and password. So now parents can go into their parent portal under health information, click the immunization link, and they have immediate access to their student's immunization record, which helps our school facilitate then their entry into kindergarten, their entry into 7th grade, or their entry into our public school if they're a newly enrolled student. And that tie to funding is oh so crucial to the public school system.
Jennifer, when a parent then logs into the portal and they get that record, what do they do with it from there? They then
they
print it out?
Yep, they can either print it or they can scan and email it to the secretary. That's then their responsibility about sharing that data with the public schools.
And then is there a staff member who then reviews to make sure that they're up to date and compliant as well?
That is correct. That's where we work closely with the Mickrs site. We can run reports to see if they're updated on their immunizations. You can probably speak more.
Yeah, the Mickrs system has two sides of it. One is the provider side and the medical community side, where they enter the vaccines that are administered through a healthcare organization and a provider office. We also have a school module where the school secretaries can log in and then create their rosters as far as the kindergarten and 7th graders and the transfer students that are coming into the system, and then they then receive the information from the parent of the Mickrs or immunization record, because it could come from another state as well, and then enter that information into that school module, and the module assists them with percentage of completeness with regard to state reporting requirements, as well as with regard to up-to-date status information for the school required immunizations.
Yeah, so I think everybody can see that although we come from different organizations and different backgrounds, we all kind of mesh together and pretty much sew that, same spider web. So thank you for that. I think the next questions that we have are geared toward Dr. Terrill and Ms. Scott. So I know you kind of touched on your roles that each of your organizations played throughout the pilot, so I wasn't sure if there was any further information you also wanted to share, where we came up with this idea, right? And so it was a concept last year, I think last August. And we were able to push this pilot into production earlier this year, and I think we all just kind of moved mountains with that. So I would just be curious to hear, what were you thinking in the beginning? Did you think it was going to work? What were your thoughts? What were your concerns?
Query was so successful within the medical community that we felt that, especially since we were able to deliver the Mickrs record in a PDF format, something that's easily viewable and easily printable, that it had applicability with regard to consumer access. Also, with regard to immunization systems, we have national standards that are put out by the CDC, and one of those standards is to deliver that immunization record to the consumer through a secure fashion. From Mickrs' standpoint, I definitely don't want to build an identity management system. So we were looking for partners who do that secure identity management process in order to then use Query, use our existing capabilities to deliver that Mickrs record to the consumer, to the parent.
One of the first things we did was meet with our middle school secretaries, so our 7th and 8th grade secretaries who are inputting this data. If you can imagine, the incoming kindergarten parents are so excited their kids are going to school, they have their immunization records updated, they're excited. By the time they get to 6th grade, they just want them to move on without realizing that they need their immunization records updated. So it takes a lot of time and effort on behalf of our secretaries, of which we have 2 for approximately 750 students. So imagine trying to contact all of those families, sending the warning letters, because if they do not have those updated records, they're not allowed to come to school. So it's very important. So meeting with our secretaries, determining that this was an area of need in our public school system, and then being able to work behind the scenes with IT to ensure the security of the data being shared, and then running multiple test runs back and forth. I'm lucky enough, I have multiple parents in my district of students that age, so we piloted it at the middle school program, and it was such a huge success that we went district-wide earlier than expected.
I know I'm going a little off script here, but Dr. Ambrose, I heard you mention in the beginning that one of the biggest problems was just getting the immunization information into the system. And I know Jen's secretaries at the Livonia district kind of had the same struggles. And we know that parents are excited to get their kids out the door after summer. So I think having to face that angry parent and telling them, hey, your child can't attend school today because we don't have your record is a huge deal. So I think before we kind of touch on the feedback that you received from the secretaries and the parents regarding that work, I'm a little more just interested to hear a little bit more about your struggles and what you're hearing from the schools or even the camp counselors of just, like you said, getting that information into the system.
Yeah, so I think that's just it. We've built a portal currently, and we've been doing this for about 10 years now, and so we have a portal in which it can pretty easily be entered into the system, but there still is that struggle of convincing them to do it. And well, our platform will send automatic reminder emails to the families so that the administrative staff doesn't have to be the bad guy calling them up. It's still working on compliance to get that information into the system. And I know as we're starting to work on a pilot and to find some pilot schools, right, in an ideal fashion, the family wouldn't have to even download a PDF. That data would just automatically sync into the SchoolDoc system.
And that is how things work on the medical side with our queries for the provider organizations, is that they receive the data back and can then reconcile it within their EHR systems. And so the difference between consumer access and provider query capability has to do with whether you need the data digestible or whether you need a practical document that can assist you with meeting compliance requirements at the schools. Yep.
Some of as we've worked to try and find some pilot organizations, some of the struggles that we've had have been sharing of data. And so, right, within our system, we have sort of an identification management system so that we are verifying, through username and password and audit trails tracking a user's activity, but in public and private schools, right, sharing those rosters with us, which they're already doing, but then we're now sharing that data with Mickrs or third parties, has presented some challenges, but I certainly see the benefit, and I think we've seen some of our schools who have expressed some significant interest as well.
And so Jen, I think it happened in February, I think is when the pilot went in production, so we've had a couple of months since then. What are the staff saying about the pilot? What are the parents saying? What are positive, negative feedback, comments about being able to access that immunization record at whichever point of the day that they want to access it?
For staff, obviously, it's huge for our secretaries. It is a huge part of the beginning of the school year, so even prior to the beginning of the school year. So here comes August, when the administrative staff starts to come back, that they're sending out those warning letters to parents, warning them that if you do not have your child immunized with the proper records, that here comes September 3rd, 4th, or 5th, and your child's not going to be able to come. So for them, they now have an accessibility point for parents where they can say, if you're updated, could you please just log on to Parent Portal, and then you can just bring in your child's immunization record. So for the secretary component, they now have another touch point with parents, which is consumer satisfaction. Even the public schools, we're really talking about consumer satisfaction. For our parents, it's, again, ease of accessibility of their child's records. Now it's instantaneous. All they have to do is log on to the parent portal, click a link, and the PDF is immediately visible for parents. So they can see, are they missing some immunizations that they know that they need to get, or they can just print it and, again, bring it to the school. So our elementary secretaries are so in favor of this. So remember, we have 850 incoming kindergartners. So as we enroll them into our system, we can enroll them without having that immunization record. So as soon as we enroll them, the parents can then log on with their unique username and password, access that parent portal, and there's their student's immunization record, which usually takes them a very long time to get, as you said, trying to schedule that pediatric appointment. If they're already caught up, they can just print it. And again, for our 7th grade parents who may have forgotten that they have that requirement, it's so much easier to access it through our parent portal. We did have a few parents that, after we sent out the district-wide memo, have some concerns that they felt that anyone could see that information. And we did remind parents that our parent portal is secure, that only the parent or legal guardian has access to their student records. Again, they have the unique username, they create their own password, so even the school district cannot access parent portal. So it was really important for parents to be able to understand that as well.
One of the requirements that we have with our early work on consumer access and a protection with regard to privacy in mind or security in mind is that those that participate in consumer access query, that those PDFs are not stored at the receiving system. It is a retrieval process. They can print it and view it right then and there, but once they leave the portal, that document is not stored on the portal at all. We encourage people to always come back and re-query Mickr in order to get the most up-to-date information, so those records are not stored on the secure portals.
Yeah, thank you, Tina, for mentioning that. I think it's also important to mention, too, that MiHIN has a certain set of security protocols in place that we require from the school. And so I know, obviously, Livonia's school district met those measures where there, like I said, a certain set of requirements that the school is able to verify that, yes, that parent is who they say that they are. So if we find out that there's a school who's interested, but they don't meet those requirements, that's something that we want to talk about with the school, that hopefully getting those requirements in place allows them to participate in this pilot program. And as Tina's mentioned too, those PDFs aren't stored. And I think what we found out during our testing phase is if you have a parent who sits there and continuously clicks the link, the record will time out. And so there's I think it's either 30 seconds or a minute that you're only allowed to click that link once. And so you can't repeatedly click it, also as a security measure. I did also want to add too that I remember when I did come down and meet with you and we did the testing, that I think both of our jaws hit the floor as to how fast that immunization record was returned back to the secretary screen. And you think of, oh, it's instant, or oh, it's going to be returned in a second, but you don't really think about how fast that query actually goes through the system. So I think just knowing that as a parent, and the struggles that I'm sure my mom faced trying to schedule those pediatric appointments, when she can just click a link and, oh my gosh, my immunization record's already on the screen. I'm sure if this was around back then, she'd be doing a happy dance.
Yeah, back when Mickr first started working with MiHIN with regard to all types of HL7 messaging, that was actually my boss, Bob Swanson, who's our division director. That was one of his requirements. It was the speed. And I remember it was a challenge for MiHIN to be able to help us with making sure that the speed of the delivery of that information was as best as it could be. But it is amazing now that we're able to deliver that information in the speed that we're able to, especially to the parent. It does amaze them how quickly that record does come through. But it is definitely a plus with regard to consumer satisfaction.
Absolutely. So Ms. Gupta, I know that you've kind of had some further information and background now of what we were currently doing in Michigan, and I understand that you have incredible knowledge and insight as to the IIS systems in Idaho. So not only am I curious as to how the systems differ between the states, but what was the feedback that you had received during the implementation phases, and what was the work that you did within Idaho?
Yeah, so I'll give you guys a little background about why I even know about Idaho's immunization system. So I've worked with ERA for just about 5 years, and before that, I worked in the Idaho immunization program for 5 years, and I oversaw the school and child care program, including the school and child care modules. So Idaho's registry and the way that it functions is actually quite a bit different than Michigan. Tina and I got to sit together at lunch and discuss the commonalities and differences. So in Idaho, the way it works is the data that the schools and childcare see within their view is the same as what a medical provider would see. And so they're not really siloed into 3 separate registries in that same way, and it's locked down by access level. And so a school nurse would be able to see more and enter more than a school registrar or a childcare provider. And so we have view access and edit access. And so if a school was to enter a historical immunization record, when the child goes to their provider office the next time, then they'd receive a pop-up that asked the doctor to validate that those shots were given on those dates. And so that's a little bit different, and kind of speaks to why we needed some unique functionality in Idaho. Another thing that is unique in Idaho is the way that our administrative code is written. And for whatever reason, our legislators in Idaho have, each time the laws have changed, they've grandfathered populations in. And so that's resulted in 3 separate categories of child care or of child entry requirements. So for school, for instance, if a child's born before September 1st, 1999, the requirements are different than a child born after September 1st, 1999. And then to make things even more confusing, we went ahead and added new requirements in 2011 that aligned school requirements with ACIP recommendations, which is the Advisory Committee on Immunization Practice, the CDC's committee. And so now there's another group that's if you start school or start kindergarten after September 1st, 2005, then you need 4 polio rather than 3, and then the group before had 0. So you can see how this would get complicated very quickly. And then to compound that, the immunization schedule really is a very complex thing. And so before the most recent rule change, schools were required only to count the doses. So they would say, oh, a child needs 3 doses of polio, 1, 2, 3. It doesn't matter if they were all given on the same day, which would never happen, but it wouldn't be valid that way. So we went ahead and added functionality to the school module that took the guessing or figuring that out away. So what it is a visual indicator of the status of whether or not they meet the requirements. So it's a red light, yellow light, or green light. So if they meet all state requirements, it would display a green light. And then next to it says, as of the date, X student meets all school immunization requirements. Or if it's yellow, it would say they're conditionally admitted. And this has been really helpful for schools and child cares. Child cares especially because it's a moving target. It's something that they have to evaluate, every couple months as children, age into new vaccine brackets. But we also added some reports. There are reports like reminder recall is something that schools can do to make sure that, if doses are gonna be due, they can send those letters out and just have them printed right through their registry. Also, right now, measles is a huge topic across our country, and there's functionality that allows schools and child cares to determine by antigen what vaccines a child may be due for or that were not valid.
So for those of us that did not sit at your table during lunch, I think we all like to hear what were the similarities and differences that both of you noticed between the 2 IIS systems.
I think the important part to know between the different states with regard to IIS systems and school modules is that the school rules are different from one state to the other, so that How our system is designed is based on what are the school-required vaccine doses by our administrative rules. We allow schools to see into the provider side of the system in order to see if there is a MiCR record already existing for that child, but the school side of the system assesses based on what are the school-required vaccinations, since all the ACIP required vaccinations for children is not the same as what's required for the schools. I was also sharing with Carmela that also the Mickrs system has been around for quite a long time. The school module has been around for a while, and we're due for some improvements, and so I was actually busily taking some notes as to how Idaho was doing things in order to try to help us with some improvements that need to be made along the way with regard to making the school, even the school module, work better for us.
Yeah, another thing that that I did not realize, well, actually the thing that made my jaw drop is that the schools have to enter all of the data, and I just could not imagine how the schools in Idaho would have balked at that idea. So I'm sure that is a challenge for you guys, and so.
You run the risk of transcription errors when
Yep.
they're re-entering the data.
Absolutely.
Or interpretation errors as to what it is that they potentially are reading, especially if the record comes from outside of the state of Michigan. That is actually one reason why the provider side of our system does not see into the school side of the system. The school side can see into the provider side, but providers do not see school-entered information. Just because it's not school nurses entering the information, it's school secretaries that are entering the information for their purpose with regard to reporting requirements and documentation requirements.
Yeah, that just seemed like it would be a difficult thing for people to take on. What they do in Idaho is they will query the student and add them to a roster. Once they're attached to that school, they don't have to do that again. It'll automatically advance to the next grade. And so that is something else. We also, in Idaho, in addition to the green status that says, yep, you've met all school requirements, at the bottom it would let them know what was recommended. So it might say a flu and HPV vaccine if their middle schooler is recommended.
Tina, are there hello? Are there discussions about in future upgrades to MiCR about getting rid of the school entry and moving more towards?
We're just really at the beginning stage of our improvement conversation. Yesterday's session on query and fire was actually quite appropriate for me to be here to hear, because one of the things that we want to do in the next few years is to move MiCR, change some architectural elements of MiCR to make it more modular, open source, and cloud-based. Making us able to then take advantage of fire. At the time that we're doing those architectural changes, we'd like to make our system ADA compliant, as well as improve the graphic, the user interfaces that people see. So it's just a time for our system to be refreshed, and it's a great opportunity to collect information from not only our the school community and school users, but also from the provider community and local health department users on how we can make improvements on the system. So we're really at the entry point of that, but I'm excited as to how we can take some ideas that are coming from our users and from other states and apply them here in Michigan.
Excellent, thank you. I think we have about 10 minutes left in our panel. Do we have any questions for anybody in the audience? I promise none of us will bite. I think if there aren't any audience questions, do we have any questions that you are interested in asking one another?
Well, actually, I just wanted to put a plug in for that. We are looking for working with the healthcare system with regard to patient portal access. We have not. We've been able to successfully implement a pilot project with a school secure parent portal, but we have not yet had a patient portal project yet in order to introduce that query capability for the PDF record to the person through their patient portal. So I'm putting in a plug-in for that. I'm also very excited with corrections being here this morning because I think there's a lot of potential with regard to integration with them, and I pretty much nailed them as they were getting off the stage to have a conversation with them as to when we can start integrating and receiving electronically data from them, as well as supplying them information that they so desperately need in electronic fashion. So we're always looking for the next idea as to how we can improve consumer access. So if you guys have ideas, please let us know. We're not afraid to be on the forefront. And we just like the opportunity to have a conversation as to how far we've come in the 8 years since we've started with Health Information Exchange and working with MiHIN.
Excellent. I know that there probably are some parents in the crowd, so if you speak to members at your school, staff at the school, and you have some questions for me or you think the school might be interested, feel free to email me. My email is pretty simple. It's megan.gibbs@mihin.org. And I think if there aren't any questions from the audience, I wanted to extend a sincere thank you to you for, again, not only attending the conference, but agreeing to speak today. And I know that was not in our original plan, but we appreciate it. So I know following the conversation today, each of us is going to continue our efforts on advancing stakeholder adoption towards the shared effort to increase immunization interoperability across the state, especially now that we start addressing this interoperability base as it's been a big part of our discussions lately. So thank you again.
Thank you.